Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Dave Chancellor, and I'll be your host today. For our webinar, we're going to be hearing about the challenges faced by low-income families looking toward retirement. And it's a real pleasure to have J. Michael Collins here to talk about this with us today. Professor Collins is faculty director here at UW-Madison Center for Financial Security. He's an IRP affiliate and is widely recognized as an expert on a broad range of issues related to financial security for lower-income families. So, Michael, thanks for being here today.
Well, thank you, and thanks for making this happen.
I also want to thank the Office of the Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services for their support of this webinar series. That said, any positions expressed in this webinar are not necessarily those of ASPE, any other agency of the federal government, or the Institute for Research on Poverty. We are recording today's webinar, and we'll have a recording and a copy of the slides available for you Friday morning on the IRP website and via email if you selected that option during registration. I'll also post a link to the slides at the end of the webinar today if you'd like to download them right away. So in just a moment here, I'll turn it over to Michael for his presentation, which should take about 45 minutes or so. And after that, he'll take your questions, so make sure to type those into the Q&A box at the bottom of your screen throughout the webinar today, and we'll get to as many as we can before our time's up. So Michael, thanks again for being here, and I'm going to turn it over to you now.
Great, thank you, and thanks everybody for tuning in on this topic today. This is a topic that really came out of a large body of work, really trying to think about the issues of retirement and disability for Americans, and I'll talk a little bit about the center that we have and how that's occurred over at the end of the webinar. But I think one of the issues that we often hear from people who are studying poverty or looking at issues of low-income people is they sort of, wave their hands about issues of retirement. Retirement's impossible for low-income people, and that retirement planning doesn't even make sense for low-income people. They can't even make ends meet today. And while I completely agree with the struggles that we all see that people with low incomes are facing, I also think we have to think a little bit about this issues of retirement, and that includes both policy issues and how do we think about programs and policies to support even lower income people as they approach retirement ages, and also to help individuals to think about planning for retirement and thinking about what that might look like even if they've never been a particularly high earning household or a high earning individual. So that's kind of the frame that I'm going to use today. I'm going to talk today, and I'm going to be pretty loose, and I'll apologize up front as I talk about low income, because sometimes I'll be referring to really deep poverty. Sometimes I'll be referring to more, lower middle income, and sometimes I'll be referring to middle low income. So, we'll have sort of different ways we'll be thinking about low income. But the issues that I'm raising, I think, are pretty universal, and so hopefully that will make sense and give us some platform to have a conversation around at the end. So I will move forward. So first, I want to talk about this in the broadest view. Again, I think we often say that while low-income people don't have access to pensions, they don't have access to retirement accounts, it's hard for them to save. How can they possibly think about retirement? And the truth is that this is even true for middle and even upper middle income people, that retirement feels very, very challenging. It's very far away, and a lot of people don't get serious about planning for retirement until they get to their 50s because of just all the other pressures of life. So this is not an issue that's especially unique to low-income families. Certainly they have greater barriers, and so we'll talk about those. I'm going to talk a lot about Social Security. Social Security really is a key program for most people. It is sort of that safety net in old age, and it's especially, it's ultimately a social insurance that protects us against outliving our savings. It is a benefit that will be with us as long as we survive. And so the key thing about Social Security, I'll show you, is that it really plays a key role for lower income households because of the way it's structured and the way the benefits are structured. That said, there are some people who won't get Social Security. They are not in the Social Security system, and we can talk a bit about that at the end. And without that, most of what I'll be talking about will be really, really challenging. But still, Social Security is really a bedrock of this system. The third thing I'll talk a bit about is housing wealth, and we can again have some conversation at the end about the struggles in the housing market and the struggles that low-income families face in getting housing. But for families who are able to buy a home at some point in their lifetime, that housing wealth really becomes the bedrock of their quote-unquote portfolio. It's a key asset that they're able to tap into retirement, and so we'll talk a bit about that as well. Next, I'll talk a little bit about benefits. And so oftentimes, low-income households may not qualify for benefits even in retirement, but they might be on the edge, and there might be some benefits they require that they can qualify for. And then for very low-income families, families who really are in poverty, either throughout their lifetime or enter into poverty in their retirement years, in their senior years, can qualify for some benefits. So I'll talk about those. And many people on this call are very familiar, sort of introduce them in the context of thinking about preparing for retirement. And last, I'll talk a bit about health care. Longtime listeners of the IRP webinars and seminars know that this is a major issue that we've often confronted really across the income spectrum, but especially for low-income people. But in retirement, these healthcare expenses become more frequent because we're older and our health issues tend to accelerate, and we also have less resources to pay for them. So we'll talk a bit about that at the end. So let me start with just a really simple graph of men and women and their life expectancy. If they make it to age 65, how much longer can they expect to live? So why do we think about this? Oftentimes people sort of benchmark in their head a rule of thumb as retiring at 65. Some people retire earlier, as early as 62, because they can claim Social Security then at a lower benefit level, and some might go longer depending on when they were born and how old they are. They might push even to age 70. But let's just use 65 as a rule of thumb benchmark. People want to think about retiring at 65. How long do you have to be prepared to support yourself after that retirement date? And so on the bottom there are different ages that you might reach that year. So in 2020, for example, a male who reaches age 65 in 2020 would expect to live about another 16 or 17 years. So that means planning ahead to be able to support themselves for a decade and a half. For women, it's close to 20 years. And because each generation, each birth cohort tends to be a bit healthier and have a little bit longer lifespan, this is going up. So people who aren't retiring until 2040 will have even longer years after age 65 to be planning around and planning for. This is a big change. When Social Security was first created in the 1930s, most people were only surviving 4 or 5 years for men and a little bit longer for women. And so, we now see a lot more people surviving into older ages, and that just requires even more focus on planning and also thinking about whether that 65 benchmark is really the right age to be thinking about retirement at all. But still, this is the primary issue that we're thinking about now. And if we look at the distribution of people by their age and whether they're still working, most people, especially by their 70s, in their 60s, about a little over half of people are still working. In their late 60s, it's about a third. In their early 70s, it's about 1 in 5 are still working. And then after age 75, it's pretty rare to see people still working. And by working, I mean working for pay. So they're in the labor market and they're collecting earnings. And then it's down to less than 1 in 10 people at age 75 and older. So most people who make it to these older years are not necessarily still working. They are retiring, meaning that they're not continuing to stay in the workforce. Now, let me just say, this doesn't mean they're not doing anything. It just means they're not working for pay. There are lots of really active retirees who do lots of different things. And there are lots of retirees who are sort of retired. They work sporadically, maybe seasonally, or they do part-time work either for the income or for other reasons. So, this idea of reaching a retirement and sitting in a rocking chair isn't necessarily the truth. It's a stereotype. But it is true that over time, the older we get, the less likely it is that we'll be working for pay. So here we can look at people age 65 and older and their retirement from work. And this is a little bit different. This is actually asking people, are you retired? So regardless of whether they're still making any money on a part-time job or other kind of role, are they working for pay at all? And so we can see among low-income people, they're actually among the most likely to, in that age 65 plus group, to say that they are retired from work, that they are self-report of not working. As we get to higher income people, oftentimes they are still reporting being in the labor force at some level. Partly this is that because some of these higher wage, higher salary jobs tend to be less physically demanding, so it's easier for somebody in their older ages to still do some of these jobs at higher incomes. And so again, that's one of the issues that we have to think about with lower income people. The kinds of work that they did when they were working might be really difficult for them to do as they age, and so they have to move into a different kind of work if they still work. So, for example, if you were a manual laborer working construction, that might be harder to do as you get older. So you shift to a different kind of job in retail, or something that might be less physically taxing. Then there's this issue of Social Security, and so these two pie charts are done by the GAO using the 2013 Survey of Consumer Finances, and there is a slightly newer version of the Survey of Consumer Finances, but the results are pretty similar that we see over time. And that's, if you look at on the left side, these are people who have no retirement savings. So they don't have, they're age 65, and they don't really have any retirement savings. No 401k, no IRA, none of these other alphabet soup programs that you've probably heard of. And so what do they do to get by? Well, for 57% of them, almost 2 in 3, it's Social Security income. 57% of their income is from Social Security. So that tends to be the way they get by. Wage and salary income is 13%. So that's a little bit of their, about 1 in 10 of the dollars that they make would come from some kind of work. Defined benefit plans. So we'll talk a bit about this in a minute, but defined benefit plans are these sort of old school retirement plans where you worked for an employer for a while and you built up credits that eventually come back to you as a pension, and that benefit is defined by the employer, and that's money that comes back. So this is for those of you who work in a position that has a pension, you probably are aware of it, you know how it works, but it's a pretty rare thing today, and so we'll start to see a lot of shift as new generations enter into retirement because this won't be as frequently available for them. And then we see public assistance and other, and so we'll talk a bit about those in a bit. So those with some retirement savings, we see quite a different story. So for them, Social Security is only about 1/3 of their support in retirement. So it was almost 2/3 for the group that had no savings. It's about 1/3 for those who did have savings. Still working, they have defined benefit plans. They also have retirement savings from distributions, so these are defined contribution plans. So we'll talk a bit about those, but those are like the IRAs, the 401ks, those kinds of plans that we've heard of. So for those people who have some savings, that savings, if you combine the defined benefit, defined contributions, and working, that really is a way that they can get by. That isn't as much a possibility at these lower income levels. The key thing about Social Security, and this is the gray box at the bottom, is that because of the way it's structured, it provides sort of a minimum level of income for people who've paid into the system, who have spent their time paying the FICA tax and contributing to the system, and it lifts a lot of people out of poverty, people who otherwise would have very low incomes because they're either unable to work or unable to work very much and they don't have any savings. The poverty rate among seniors, among the elderly, would be much higher than it currently is. It would be as close to almost 40%, 39%, without Social Security's key role for people, instead of what it is today, which is about 9%. So Social Security really does play an important role in sort of keeping a lot of low-income people as they approach their older years and approach retirement from being in this sort of poverty level of income. So most of you know this, but I'll just quickly do an aside on how the Social Security program works. Now, one of the things that's important when we talk about Social Security is that there's several different programs, and we use the term Social Security usually to refer to the Old Age and Survivors Insurance Program. This is the program that you claim when you reach retirement age. There are other Social Security programs too that we can talk about. So the Disability Program, the SSI Program. So there are other programs out there. But the one that we really think about when we're thinking about retirement planning is the OASI, which is the monthly benefit that you get once you claim. Social Security is funded by FICA taxes, and you probably saw in the press the last few weeks or last month or so, as the actuaries put out their reports on the Social Security Trust Fund, they sort of project when that fund will no longer be able to fund people's benefits. And that's all because the FICA tax just won't be enough. There won't be enough workers paying into the FICA tax to be able to pay out these benefits. Again, we can talk about that at the end, but the security of Social Security is really important, and it comes out through that FICA tax that people pay on that first, roughly $120,000 of their earnings. So you all see this in your payroll on a regular basis of these FICA tax earnings. So essentially what happens is people pay into Social Security through that FICA tax, and Social Security tracks that through the payroll and other systems. And so you get credits as you work longer, and each quarter that you're working counts towards the credit, and eventually you get towards 40 credits, and you get 10 years of work experience, and you can potentially claim. The longer you work, the more you contribute into the system, the more potentially your benefit might be up to a limit. So essentially, the benefit itself is based on this primary insurance amount, or PIA, because we all love to use acronyms in this field. And basically it takes the highest 35 years of earnings to calculate what the benefit would be. But that's not the only thing that affects the benefit. It also depends on how old you are when you claim. And sort of the earliest you can claim is at 62, depending on when you're born, and that's what this chart at the bottom shows, is that there's different ages. So 67 would be anybody born after 1960. That's sort of sometimes called the full retirement age. That's when you can get the benefit that's larger than the benefit you would get if you claimed before that age. But then for many people who can do it, waiting until even age 70 might increase that amount of benefit even longer or even larger. So you can get a little bit more every year. It's about 8% more per year that you delay with these delayed benefit credits that you can get, up to about age 70. And then after age 70, there's really no benefit to not claiming, and most people do claim by that point in time. There's a link at the bottom of this page that has the Social Security estimator. This is a nice tool if you're curious for yourself or for people that you're working with to start to estimate how much might be available for Social Security. Temper your expectations. If you think it's a lot, it won't be. But for a low-income household, it can come close to replacing half or even more of their income as they approach retirement. So this is an example of actual data from the administrative data from Social Security, and that the census has worked with some of their data as well. So trying to match the different data sets that are out there to understand where people's income and earnings are coming from. So these are people age 65 and older, and by each income decile. So you can imagine if we divided all the people in the data up into groups sort of in order, where 1 are the lowest 10% income and 2 are the next 10% lowest income, et cetera, and that 10 would be the highest income group. So a few things I'll point out on this. So for the very lowest income deciles 1, 2, and 3, you see the SSOASI, the Old Age Survivors Insurance, is a pretty large share of people's income. But for that very first decile, that very lowest, most deep poverty group, the SSI, the Supplemental Security Insurance, is a key program. So sometimes you might hear SSI referred to in issues with kids or very low-income households. So essentially, this is the part of the program that serves very low-income seniors. So people can both receive their old age survivor's benefit as well as the SSI benefit if they have very low incomes. And it's really critical for that very lowest group to provide them some additional income from that program. That really fades out, though, at the second decile. So once we get out of that deep poverty group, the reliance on SSI or the use of SSI goes way down, and after the third decile, we don't see it at all. The other thing I'll point out about this is the earnings column. The very second column there shows, each decile we show more earnings. So for the lowest income groups, work is just not often something that they're able to do. Often they've struggled to work during their lifetime, during their working years as well, but especially as they get older. And so perhaps that's health, perhaps that's because of the skills they have in the job market or other kinds of reasons, but earnings isn't a big option for them. As a share of income, the third column, you can see that the old age is really a key component of their income and retirement. Retirement plan, really very low numbers for those first few deciles. It's not till you get into the more middle and upper income groups you start to see more use of the retirement plan. It actually tails off at the very highest income because oftentimes those folks will have already maxed out their retirement plan options, and they'll have savings that's just not in retirement plans at all. It's just straight assets or wealth. But I want to point out one last thing on this slide. I know there's a lot of data on this slide, but it does tell a lot of the story that we need to think about. You look at the very last column there. That's the amount of benefits that households receive. And so if you think about the difference in incomes from that first decile to the 10th decile, that's a huge range, right? So we're talking about incomes rising from probably $10,000 to over $200,000 or $250,000. So, order of magnitude of 20 or 25. But if you look at the SSA amount, it only doubles. It goes from about $12,500 to about $25,000. So this is a key feature of the way Social Security is designed. It allows the very lowest income group to receive a benefit relative to their income when they were working that's quite a bit larger than what the highest income groups are going to get relative to what they received when they were working. So there's sort of a built-in component of Social Security which really helps support people at the bottom end of the income distribution. Now you might say $12,000 is not very much, and I agree. That's not going to be enough to get somebody through retirement as an annual salary or as an annual income. But it certainly, relative to the income that they had when they were of working years and piled on with some other kinds of programs that they can be involved in, can make it possible for them to have some years of retirement with that support from Social Security. So let me just be concrete and think about an example of a male born in 1962. So this would be somebody in the sort of tail of the baby boom who began working, at about age 18 in 1980, and they worked every year, all year round, until they got ready to think about retiring. So these are people who today, if they were starting to think about retirement planning, would be in their 50s. That's pretty common. I mean, it's not uncommon for people to think, mostly about trying to raise a family and do all the other things that are involved with life and then get into their 50s and say, oh, I need to start planning for retirement. So this is not an uncommon scenario. So if this person were to think, okay, I want to retire at age 65, that's in 2027. So I need to start thinking about that plan. And let's just imagine that they began working in 1980 with a $12,000 wage, and that wage just increased by, roughly the rate of inflation, about 3% a year. So today they're making about $25,000, almost $26,000. So not a huge income. Depending on their family size, might be, some multiple of the poverty level, not deep poverty, but certainly not high income either. So now let's make another assumption and say they actually were able to save 3% of their salary per year. And we'll come back to this. I know you might say that seems like a lot, seems unlikely, but let's just use that as a baseline to have a discussion. They save 3% of their income annually, and that grew at 5% annually. So they were able to somehow have an investment or have some kind of rate of return on that money so that it was able to grow over time. So by the time they reach retirement, they would have $94,000 saved, roughly, enough to pay for a few years of their retirement. And they would have about $15,000 from Social Security. That would be their annual benefit if they were to claim at age 65. But let's say that they, when they retire in 2027, they're making $25,000 now. They'd be making about $30,000 when they retire. And let's say they really want to be able to maintain that $30,000 a year income when they retire at age 65. They would have a gap of about $15,000 per year. So there'd be a $15,000 difference between what they got from Social Security and what they were able to what they would need to be able to replace their income before they retired. And so that would mean if they retired at age 65, by age 72, so roughly 7 years, they would have burned through all of their savings and would have no savings left. So there would be nothing left. Their income at that point in time would drop down to $15,000 a year. It would be a much more constrained level of consumption. Not that $30,000 was a luscious or a luxury lifestyle, but now they really are at a much lower level relative to what they were making when they were working. So let's think about that scenario as a starting point. So a few things that sort of kind of are rosy in this scenario, which I'll talk a bit about. But one is that we're assuming basically 100% replacement rate of income. And this is something that financial planners think a lot about with clients, is how much do you need relative to how much you made when you're working in retirement. So sometimes replacement rates are as low as 70% or 60% of your income before you retired, and sometimes replacement rates are over 100% because we think we're going to need to spend more in retirement than we did before. So this assumes 100% replacement rate, which actually for a household making $30,000 is probably pretty reasonable. The next is that they were able to save. This person was able to save for their entire working career about 3% per year. They had access to saving programs. Those programs they were able to access actually had good returns and not high expenses. They were able to work without disruptions, without any health problems. They didn't have a lot of debt. They didn't have any, other demands that they had to pay. The service of debt isn't going to be something they have to manage in retirement. And then we're kind of, hoping for the best in terms of spouse and family issues. That, if there's a spouse involved, that would at least be, potentially another source of income. But, a lot of families as they reach retirement are still dealing with maybe their adult children or non-adult children or second generations or caring for grandchildren. So there's lots of other issues that can be involved with a family. But again, we're sort of thinking about this as a simplest case. So let's start with this issue of being able to access retirement savings plan through an employer. So this is the data that's collected by the Bureau of Labor Statistics on employers. And at the lowest 10% of income level, about 1 in 3 workers has access to a defined contribution plan, and only 4% have access to a defined benefit plan, to that traditional pension plan. If we go to the lowest 25%, it goes 8% have a defined benefit plan and 41% have a defined contribution plan. That means there is no employer-based option for saving for retirement for the majority of people at the bottom quarter of the income distribution. It just doesn't exist for them. As we get into the second quartile, so this is just below the median, we start to see about half, 62%, have access to a defined contribution plan at work. So it gets a little bit better as we go up the income spectrum, but we also see a lot more defined benefit at the same time. So a lot of the places that lower wage workers work don't have access to savings at work, and so this is a big issue. And we've seen some states try to confront this with statewide savings plans. We saw a proposal in the previous administration to try to create some retirement savings vehicles for people that weren't affiliated with an employer-based plan. But employers are the bedrock of our retirement savings system. And for people who work in employers that don't have those, that certainly undermines that sort of ideal model that I showed you earlier. Here's the other thing, is if we ask people in their 50s, so this is 55 to 65, just before retirement, are you saving for retirement regularly, meaning every paycheck or every month? It's only about 1 in 3 of the lowest income groups, whereas, it's by far the majority of the highest income groups, 3/4 or more. So we still have this problem. Even if the plan exists, people aren't able to take advantage of it. And so we see an inability, especially low incomes, just because you don't have any extra money to be able to save. The other thing we see is, if you ask people, have you figured out how much you need to retire? Or another version of this question is what age that you think you're going to be able to retire. At the very lowest income groups, the majority of people say they haven't even tried to do these estimations. And you can imagine why, because why bother? I think this is going to be really hard. And so, I just don't think I'm ever going to be able to retire, or, I'll retire by, out of necessity because I can't work anymore. And I'm not going to try to do any planning around that. And I think this is, one of the issues that I think is challenging. So we have a pretty robust retirement planning system through employers, through private sector, but they don't really work with low-income people. And so, it's not until you get into that highest income groups that you start to see much of those financial planning services and advice that are out there. At the lowest income levels, really there's nothing, there's very few planners that will even work with that population because they just don't see any potential profit or any potential fee revenue for them. And so it's a real challenge for other than employers, there's not a lot of resources available, a lot of services available to help people even do these planning steps as they move forward. So I'm going to talk a little bit about housing. So obviously not everybody becomes a homeowner, but even low-income families, especially in more rural areas, especially in sort of the exurbs and other places, often will become homeowners at some point in their lifetime. And so if we look across the the income distribution, housing wealth really becomes a key way that people are able to save. Now, you might say, well, housing is a form of consumption that gives me a roof. It doesn't give me savings, which is true, but it also provides a bit of a way to save. There's this forced savings in that amortized mortgage that we have, and that is a way that people accumulate some assets. And so people at the lowest income levels have more in a paid-off house than they do in savings. And the value of that obviously gets higher as you get into higher income levels, but it can be really a key source of wealth, and oftentimes a source of wealth that, with a little bit of planning, people can use to extend their retirement a little bit. So this is some data tabulated by the Joint Center for Housing Studies, which really has excellent resources on these kinds of topics. But if you look at the amount of home equity that the lowest income groups, and these are people aged 50 to 64, again, sort of in that pre-retirement planning phase, their housing wealth, their home equity, is $55,000 to $60,000 in these lower income categories. Their non-housing wealth, that's basically everything else, is tiny, between 10 and roughly $10,000. So there's not a lot of other resources available, and most of their net worth is actually in the home. Now, for renters, the picture is much more bleak. There's very few assets among renters, and it's the home really that sets the renters apart, and that housing value that is becomes part of their asset base. So we do have some programs to help people think about ways to convert that home equity into something they can use in retirement. Obviously, they could sell the home, and that would give them some cash they could use for consumption in retirement, but that's not always feasible for a lot of reasons, including a home that I have no mortgage on is basically paying me to live there. I don't have to pay any rent. It helps lower my costs. If I choose not to put a lot of money into maintenance, which you often see with older people, that's another form of savings that I can, just not have to spend that money on those kinds of things. So there are ways that people can do this, but the formal way is something called a reverse mortgage, or especially for low-income households, it's the home equity conversion mortgage, sometimes called HECM. And these are for homeowners who are 62 or older, and they can actually take that home equity, and instead of a mortgage that they pay a monthly payment for, it's a reverse. It gives them either a lump sum or a lump sum and some combination of payments that they can receive. And so there's some research that Stephanie Moulton and our colleagues at Ohio State did looking at why people took out these loans, so it's from surveys. And, I think there was a perception that people were cashing out their home equity with these loans to, make a big purchase or go on a trip. But that really wasn't the story. It was everyday expenses. People were using this cash for consumption or to pay off their forward mortgage, and that way they didn't have to pay a mortgage every month anymore. They sort of paid it off with the reverse mortgage, or they, found other ways to pay off other debt, and that helped them free up cash flow so that they could retire with a little more cushion available to them. Now, the trade-off here is with a reverse mortgage, when you die or when you sell the house, the proceeds of that sale goes to the lender. So the loan is paid back when the house is sold or when the owner is deceased. And so the trade-off is that the heirs of the estate don't get anything from this house. And so that's one of the constraints to these reverse mortgages, is that families don't necessarily want to give up that ability to pass the house on to the next generation. But still, for a growing number of especially lower income households, it is one tool they can use to try to create some assets in retirement or create some income in retirement. Another program we can think a bit about is the SSI program. About 2.2 million seniors get SSI, so this is a pretty small program relative to the overall retiree population. The key things about SSI is that the benefit levels are not very large. I mean, it's about $750 for a single, or a little over $1,100 for a couple. It has some asset limits. You can't really have any savings or much in the way of assets outside of a car and a few other basic assets. And it really only serves people at very, very low income, so up to about $14,000 for a couple as a total household income. So it is a program that really that safety net for the lowest income elderly. And oftentimes it's in addition to their old age insurance if they were able to work long enough in the Social Security system if they got their credits in. And, oftentimes Social Security, the SSI is combined with programs like SNAP food assistance or Medicaid, the healthcare assistance. So lots of different support systems there. The key thing about this program, though, I want to highlight is that its use has actually declined a bit for, especially among the earlier retiree groups. And these are applications, so we can look at the actual beneficiaries, and I think we'd see pretty similar kind of patterns. And so there's a lot of reasons for that. I mean, I think one is the qualification standards are tough, and a lot of families earn more than they can qualify for SSI, but not enough that they're really out of poverty. And so it really is at that very deepest level. And it tends to oftentimes be more important as people age in their 70s and older. It's a tough program to think about retirement planning around as well, because you don't exactly know where you're going to be in terms of your qualification when the time comes. Another program I'll talk a little bit about is housing programs. So we do have about 2 million elderly households who get some kind of housing assistance, and there are many housing programs that are designed to support the elderly. Elderly tend to be a priority group in public housing and in other kinds of housing subsidy programs, especially if they have a disability. But again, these programs are administered largely at the local level, and so there's a lot of variation across states and even within states across housing authorities about qualification standards. But generally, you're thinking about a very, very low-income household, less than 50% of the area median. HUD has their own system for eligibility in terms of income and family size that varies by location. But typically, the income, sort of close to the income cutoff, is around $10,000 for a lot of these programs. So again, it's very much a deep poverty program and not something that somebody who's just above that level is going to be able to get into. But even more so, there's a shortage. And so, at best you're getting on a waiting list and waiting sometimes for years to be able to get access to housing. So it's a very difficult program to plan around. Seniors with disabilities might have a bit of an edge, but, you'll see people get on the list in their 60s and not actually get into housing until their 70s. So it's definitely a challenge for people to think about this as an option as they age. Food assistance, certainly SNAP, which is a major program across the age groups that are using SNAP, and you can see here the percent of SNAP benefits that are going to the elderly. It's about 11% of all SNAP benefits are going to people 65 and older. SNAP is oftentimes in conjunction with SSI. In some states, it's almost a dual program. So that can be a program that can help people get by. But again, it's we're talking about $11,000, so really much a deep poverty program, and it's about $1,500 a year in SNAP benefits that people get. So it certainly helps with food consumption, but in terms of overall consumption for seniors, it's a challenging program to think about really making ends meet. Energy assistance, this is a program that oftentimes, again, has a focus on elderly households. About 2 million households get this as well. The benefit levels are pretty low. It's really just to help people with their either heating or cooling, and oftentimes it's in emergencies when they are struggling with maybe a repair or weatherization or other kinds of issues in a crisis, or just high bills. It does serve a little bit higher income level, especially in some states and some areas, but a relatively small program, and actually a program that's been cut quite a bit. So again, a hard thing to think about really using a lot as people approach retirement. So those are some of the public benefit programs we have. I mean, another option we could think about is, lower income people could work longer. The challenge here is that we just don't see a lot of, workforce engagement for older households, and especially as you get to that age 70 and older. That's the lowest black line here. Basically 1 in 5 are still able to work at 70 and older, and we have seen some rise in the 60 to 5-year-olds and even 62-year-olds who are working, but generally working is a challenge. You have to be healthy enough to work. You have to find work that's available that you want to do. It has to pay enough, and so all these things make working a challenge. I mean, certainly the longer you can delay retirement, which we'll talk about in a minute, can be a solution, but it's not a solution all the way through retirement. For most people, working up through in the 80s is really a challenging thing to think about, and oftentimes just because of the physical nature of work. So let's go back to our example of somebody born in 1962. They're probably going to earn too much to qualify for any of these benefits that I just described. If they own a house, they could use that to pay down debt, or they could use that equity as income if they don't already have debt on that house. One option might be to try to delay claiming Social Security until age 70. That would raise their benefit from before. I remember I said it was $15,000. Now it's $21,000. So they would have a bit more Social Security benefit coming to them. Plus, they would have worked for another 5 years, so they would have saved for another 5 years, and all that savings they had would have grown. So now they have $125,000 in savings. Their gap is now down to $12,000 per year. So the gap is smaller between their income and what they needed, and they can use that savings until they reach age 81. So if they use that savings to make 100% replacement rate, they could make it to age 81. Now the expected lifespan for somebody who was born in 1962 and it makes it to age 70 is about 85. So they'd still be about four years short of what they needed to get by. If they're healthy and if work exists, they can work part-time. That would stretch things out. They could cut expenses, which again, it's hard to do at that level of income. And they could rely on spouse or family support. And beyond that, this is a challenging group to serve. Sometimes what will happen is people reach their 80s, their income really starts to drop. They get into that kind of deep poverty level and might qualify for more support and programs at that point if they're able to get through the process of qualifying and applying. One thing I think we have to keep an eye on, and this is data for everyone, not just by income, if we look at people's financial well-being, and so there's been a sort of effort to create these financial well-being scales that really get at not just what people's income or assets are, but really do they feel in control of their finances, or are they stressed about their finances? And we see a bit of a dip, and it's, we're still collecting data, so I don't think this is just a statistical anomaly. I think that we'll, as we start to get more volume, we'll start to see this more, but we start to see a bit of a dip as people reach their 70s, that there are some challenges with managing your finances as assets start to go down and being able to get by. And so I think this is an issue we're going to have to think a lot about as we see the baby boom entering into these years, and as we see lower income, even people who had maybe more moderate incomes in their working years have lower and lower incomes as they age, and that stress of being able to manage their finances might be a real issue to think about. We also are going to have other issues going forward. About half of people who reach age 65 are going to require long-term care at some point. So we see a lot of those folks, when they're in the Medicaid system at the very end of life. But that could even happen before they're at the very end of life, other kinds of at-home care or other kinds of services they might need. And, oftentimes those don't just impact the person who's not well, but it impacts the people around them who have to give their time for caregiving or for other kinds of expenses. Out-of-pocket medical expenses are rising. That's a big issue that we see more and more. And then, even as people age, they still might be caring for their adult children or grandchildren. So, all these are further issues that especially more fragile families with lower incomes are going to be dealing with as well. I'll just touch quickly on this healthcare issue. Even with pretty good coverage that you get in Medicare, out-of-pocket costs for premiums, for co-pays, for co-insurance, deductibles are rising for everyone, and especially at lower income levels, they're not indexed for income. So these out-of-pocket medical expenses could take $1 in $4 that low-income people have in retirement, and I think we're seeing this increase over time. So this will be a special issue to pay attention to. This cost sharing that we see across healthcare systems could disproportionately affect low-income households, especially low-income households in retirement, who we know are also at sort of the peak ages for having healthcare costs because they're older and facing more healthcare challenges. There's a lot of other issues I didn't talk about today that I think are important. Issues of estates and how you deal with titling property, issues of life insurance, which even low-income people oftentimes will have a life insurance, maybe they accumulated 25 years ago. Dealing with mortgages and debt, dealing with taxes, making sure you keep track of those, if you've had multiple jobs and collected little tiny retirement accounts over time, you don't lose track of them, and that you don't run afoul of any tax rules on how you use them. So lots of other issues that low-income families oftentimes can get stuck in. So looking ahead, just to wrap up, I think as we think about policy changes and look at the Social Security Administration and their, especially the old age program and all the issues around the actuarial trust fund and when that's going to go under, the worst case scenario for most of us is that we'll get about 75 cents on the dollar or 70 cents on the dollar of what we would have gotten otherwise. But for low-income households, this could be much more detrimental. And so, as we think about the policy issues related to the trust fund and to the payroll tax and to the way Social Security is structured, we need to really keep an eye out for the issues of low-income households and what it means for them. The issues of housing wealth, housing is not easy to access, especially owned housing, owner-occupied housing, but it really can become a key way that people, even at low incomes, can have an asset in retirement. This issue of healthcare costs, especially at end of life, but just generally out-of-pocket costs, are something that more and more retirees are trying to find ways to manage, and it's disproportionately affecting low-income households. Anything that we can do to reduce the consumption costs for the elderly, energy costs, housing costs, energy efficiency, transportation costs, and even benefit programs are really important to be thinking about as ways to support older people as they are in their retirement years. And then again, I'll just say that a lot of the examples I gave were people who were just above their poverty level or sort of scraping the poverty line. But at very, very low incomes, benefits are critical. We just can't think of a way to really support people at very low incomes who weren't able to save, who don't qualify for other kinds of retirement programs. It really becomes key for programs like SSI and SNAP and other kinds of programs. So I'll end just with a quick, I think it's I don't know what you call it, a shameless promotion, but a textbook that I worked on with Margaret Schrodden and Julie Birkenmeyer. So this is a paperback book. It's, I think you can find it online for about $20. It's a book that we designed to teach caseworkers, social workers, other people working with low-income households about financial issues, including a whole chapter on retirement. And so, oftentimes it's just a way to take what is conventional financial planning and apply it to people who, are at a lower income level, and to try to provide more accessible materials to people who are in those fields and in those programs working with those people. I also want to say we're the center that I direct here at Wisconsin. We do have a cooperative agreement with the Social Security Administration to both study retirement and disability research over the next 5 years. So there'll be a lot of research in this space. Today's presentation in no way represented that work or the views of the Social Security Administration, but the website's here, so this might be a place if you're interested in especially the policy and research issues around these programs to gain more information about those as we go forward. So just the same disclaimer that Dave said about ASPE and HHS also apply for the work that I just said. So I'll stop there.
Wonderful. Thank you so much, Michael. That was a great presentation. I think there was a ton of useful information in there. So I do want to remind folks to type in those questions to your Q&A box at the bottom of your screen as we go along here. And as promised, I'm just going to post those slides for all of you. You can grab those kind of as we finish up this webinar today. But Michael, kind of one of our first questions, and this sort of piggybacks on an observation that Jerry made, is that when a lot more lower income workers had access to pensions, in a sense they did sort of have professional management and professional financial help, and I think this might be kind of pointing towards your book that you just brought up. But what sort of resources are out there now for lower income families to get help as they plan their retirements, or is there anything of scale that people can look towards?
Yeah, it's a great observation and a great question. I think it's a challenge really to all of us to try to think about ways we can better serve people who aren't served by the traditional market. So for most professionals or advisors or fee-based planners, this isn't a market that they can, this is not a focus, and so not a group they work on. Employers are about the only way, and it's exactly right. In the days of defined pensions, really the employer took care of it for you. You just signed up, and you could hopefully depend upon a benefit when you got to retirement age. You'd understand the rules and how you claimed and take advantage of it. I think the challenge that we have is that, oftentimes the people who work a lot with low-income families, aren't coming from a background where finance is sort of part of what they've been trained on, and so they need to partner with somebody who's got some of those skills, or start to incorporate those into some of their own work. We've seen some interesting programs with AARP using volunteers sometimes, oftentimes people who maybe used to be in the financial industry and sort of can do that on a pro bono or a no-cost basis. I also think we've probably got a growing set of however you want to label them, sort of technology-based financial planning tools out there that should be available at much lower cost. And I haven't seen any of them really aim squarely at the lowest income groups, but those kinds of tools, especially as we have more technology-savvy generations coming up, might be really ways to provide low-cost services for even lower-income families.
Okay. So we have a question from Barb, and she kind of points us back to the original title of this webinar, asking, is retirement planning possible for low-income families? And she kind of suspects your answer is yes, but it probably looks different than for middle-class families. Is that right? And do you want to go into that a little bit more?
Yeah, I think yes, but is exactly right. So, the case I gave of, somebody earning a very modest income and being able to save and approaching retirement with a sort of, planful mindset, it's possible. I mean, I didn't make it up. It really is a true thing that could happen. It's just, but there's a lot of challenges to that. A lot of things have to go right. You have to have able to work consistently, to have access to those savings vehicles. A lot of things have to go right. You can imagine, lots of hiccups that could happen in people's lives that could deviate. So everything from a sickness to a divorce to a sick child to some other kinds of things. So, if everything goes right, it's possible. And I think the key is, we can't just ignore the issue. And so the more we can help people to think about retirement as a feasible thing to plan for. And yes, it might be true that we're planning for a relatively short retirement, but having some plans in place, I think will at least help people to think ahead, maybe be less nervous, and perhaps even be able to enjoy some of those retirement years a bit more than if they really didn't think about it at all.
Okay. So earlier this week, there was an article in the New York Times that kind of cautioned people against taking a will-see approach to when their retirement actually happens. We didn't talk about specifically when that happens, but I suspect, especially for folks who may be sort of aging out of physical ability to sort of do their work, that retirement might kind of sneak up on them. What can you tell us about that, and what do we know about people whose retirement sort of comes by surprise in that sense?
Yeah, I think there's a lot of challenges when we talk about retirement, because it's not a switch you flip. Sometimes people ease into retirement, and sometimes people get thrown into retirement because either the employer that they had and the kinds of work that they had disappeared, or because they're not physically able to do the work. And that presents some real challenges for folks. An earlier retirement than planned can, even if they were planful, really throw things off, and it's hard to plan around those kinds of unexpected things happening. The issues of people, especially with disabilities or other kinds of constraints that keep them from working, I think we're seeing actually some positive movement on that. We're seeing people who were, sort of locked out of the labor force because of disabilities now able to get into the labor force. We're seeing more and more, a higher rate of people into the labor force. Now, great, this is a really strong job market, and maybe this is an anomaly, but maybe it is that employers are adapting more to people's needs. Maybe it's the nature of work is changing so that we have more ways to accommodate people with disabilities through technology and other kinds of things. So there might be some hope in that, but I think for lower income people, unfortunately, are oftentimes not at employers that really have the kinds of disability programs in place. They don't have the income continuation programs. They don't have the early retirement for disability kinds of programs in place, and that creates really a key group that's both struggling on the financial side and on their sort of physical and mental health side. And a group that we probably should be thinking more about.
Okay. We have a question from Nick. He wants to know more about sort of asset limits for public assistance programs aimed at lower-income folks who are retiring. And what are some of the issues that we run into with that? I mean, I imagine that for some folks, they kind of are sitting close to that limit, and that it makes it really challenging to kind of plan for those things. Do you have anything to tell us about that?
Yeah, this is probably a whole topic for a webinar, actually, the issue of asset limits. You know, the sort of whatever popular the rumors that go around in communities are that, you know, if you have enough assets that you won't qualify for certain programs, and you know, some states are stricter on programs like SNAP or others. You know, I think the program where we see the most binding asset limit is really around Medicaid, which I really didn't have a lot of time to talk about today. But, you know, for Medicaid, you know, that becomes sort of a key sort of end-of-life program that you'll use, and that actually isn't just low-income people, because when you have expensive care like nursing home care, even if you had some savings, it will go quickly because the cost of care is so high, and then you become eligible for Medicaid. So Medicaid tends to be one where we think about these asset limits a lot. The other programs, you know, those asset limits are high. I mean, I think it becomes a discouragement from savings, but the income levels of those programs are so low that oftentimes those people are never going to have even close to that level of assets. So I think part of this is managing perceptions and helping people understand, you know, when they may or may not be affected by these asset limits, sort of separating the issues of Medicaid, and then, you know, to the extent we can, trying to work with policymakers around when do these asset limits really make sense, and for what groups do we actually want to encourage savings for things like retirement.
Okay. I want to talk about housing for sort of our last question here. You know, in a lot of areas of the country, you have pretty hot housing markets right now, and so it would seem that, like, for people that own their home, that's maybe a big plus, but for people that are renting, just that fluctuation in rents could create a real challenge. So it seems like there's sort of this dual thing there. Could you talk to us more about that?
Yeah, I mean, housing is an enormous part of people's lifetime expenses, and like I said in this webinar, it can become a real asset that people can use in retirement if they have owned housing. So we sort of have 2 or 3 different issues going on with housing across different markets. One is, can people access owned housing? Can they qualify for mortgages? Can they find a house that's affordable? You know, in many areas the costs are so high that it's just out of reach. Even with the most aggressive assistance programs and the most aggressive mortgage programs, they're not going to be able to buy a home. And that really locks them out of that sort of asset building opportunity that they could have had. And then that's a real challenge. I think to think about home ownership for low-income households is a real key policy issue going forward. But then for, you know, especially for older households who are not able to, never able to buy a home or not able to keep their home as they age, rents are high. And rents are high in rural places. They're high in small towns, and we just see higher and higher rents really across the country. We haven't had a high level of construction, and even as the population has grown. And so we have, you know, many housing markets with high vacancy rates and shortages, and that's driven up rents. The programs I described from the federal level and, you know, even the state companions to those just are not sufficient to provide enough housing. There's a shortage of affordable housing. We have a lot of, you know, limits on how low quality we'll allow housing to be, which is a good thing. But that also means we essentially put a floor on what housing prices can be. And so, you know, the ability to find a quality rental unit in many communities is very, very difficult, especially for an older person, with any kind of disability. And so these housing policies, which are quite local, I mean, this is local planning, you know, people saying, I don't want to build this, you know, this housing complex in my neighborhood because it's going to somehow affect me. That actually reverberates, and so I think these are really key issues that even on the local policy level to be attuned to.
Okay. So, Michael, I want to give you an opportunity to give us kind of a wrap-up statement here. What's your takeaway, you know? So what should we be looking for, like, that you'd like to see more research on, or sort of like longer-term policy implications? What can you leave us with here?
Yeah, I mean, I think I want to end on a somewhat positive note and just say it really is possible to help even lower-income households to plan for retirement. And I think this idea of just throwing our hands up and saying, well, there's nothing we can do. You just can't save. You can't make ends meet. it's a really part of that whole life course that people go through of work and retirement and all the sort of aspects of retirement that people should have the ability to do. But we just don't have a lot of the infrastructure in place, whether it's savings at work or the advice systems, the other kinds of things we talked about today. So really keeping an eye on our, both in our research and in our policies to make sure that we're thinking about the issues of low-income people, even in what might seem like a long shot of retirement, making sure that we don't throw that out completely.